Uskoro počinje live stream. 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 Uskoro počinje live stream.
Dobar dan i dobrodošli u Infocentar na potpisivanje finansijskog sporazuma o podršci zdravstvenom sektoru. Prije samog potpisivanja obratit će vam se naše današnje govornice, ambasadorka Ana Kristina Popa, šefica delegacije Evropske unije u Crnoj Gori, ministarka Jelena Borovinić-Bojović,
of Health, Jelena Borovinić-Bojović, and Chief Negotiator Zorka Kordić. Ambassador, the floor is yours.
Hvala, thank you. Dear Minister Borovinić-Bojović, Chief Negotiator Kordić, Your Excellencies, media representatives, dear guests, throughout the pandemic, the European Union has repeatedly shown that Montenegro is not alone in this unprecedented crisis. Back in March, when the COVID-19 pandemic first hit Europe, the EU spared no time and effort to provide essential and unparalleled support to the Western Balkans, quickly making available to Montenegro €3 million to address some of the most urgent needs of the health sector. This consisted of 100 ventilators, 10 digital X-ray machines, and tens of thousands of masks and protective equipment that were provided throughout 2020. This equipment was vital in ensuring health workers are safe while taking care of those in need. In March, we also allocated a response package of €50 million in non-repayable financial aid. My colleagues, both in the EU delegation and in Brussels, worked very hard together with the Montenegrin authorities to identify needs and a significant part of this aid program, in the amount of €40.5 million, has been allocated as direct support to the state budget for mitigating the economic fallout of the pandemic and supporting the authorities' social and economic response. In November, the EU paid a first installment of €28 million. Today, we are here to sign a financing agreement for the remaining euro in the amount of 9.5 million of this program. COVID-19 showed the necessity to strengthen Montenegro's healthcare system, its resilience and its preparedness to effectively respond to potential new outbreaks. The funds that we are granting here today will support the health sector in the aftermath of the health crisis. And this means investing in infrastructure, equipment, and human capacity on disease control to address health security risks. Our support envisages the purchase of PCR equipment able to analyze a large number of respiratory samples for the detection of COVID-19, which will increase national capacities for coronavirus testing and detection. The new health package also contains actions that are directed to long-term support to Montenegro to deal with similar threats. Various facilities will be built to host medical structures important for the prevention and control of contagious diseases and for the treatment of those patients. Let me single out in particular the construction of the clinics for infectious diseases and dermatovenerology, the Center for Control and Prevention of Infectious Diseases with an emergency operating center, and the first biosafety level 3 laboratory. The EU will work together with UNICEF to improve the vaccine management system to ensure continuity of immunization and increase immunization coverage, and to implement an effective and coordinated communication and community engagement strategy. All Western Balkan countries, including Montenegro, have joined the COVAX facility to secure access to vaccines procured at a negotiated price. In December of last year, the EU allocated 70 million euro of EU pre-accession funds to purchase vaccines for the Western Balkans. This money is available for grant agreements with EU member states through a set of special resale agreements. In its communication of 19th of January of this year, the Commission is committing to setting up an EU vaccine sharing mechanism with special attention given to the Western Balkans. The latest opinion poll tells us that Montenegrin citizens recognize and appreciate the EU citizens' support and solidarity in these difficult times. This clearly tells us that our friendship has not only stood the test of hardship, but that it has grown stronger, and we continue to stand together and demonstrate the power of solidarity as our core European value. This health crisis, no matter how challenging today, will pass, but the clinics and the laboratories will stay. We want to look to the future and continue to improve Montenegro's health system by bringing it closer to European standards. This is what this country deserves, and it is the very essence of the integration process, to improve the quality and life of the citizens. Global cooperation and solidarity is our only chance to defeat this virus everywhere, but also to start a sustainable global recovery. And the EU is playing its full part. EU citizens will continue to stand with their fellow Europeans in Montenegro, and we will weather this crisis together in the spirit of solidarity, friendship and cooperation. Hvala vam.
Thank you, Ambassador. Minister Boronić-Bojić.
Kao prvo, želim da se naravno zahvalim.
Firstly, I would like to thank to dear Miss Popa, and also to Chief Negotiator, Ms. Zorka Kordic. Of course, I want to express special gratitude for all the support and help European Union has given and demonstrated towards Montenegro on its path to the EU in terms of solidarity and friendship in hard times. And this support for Montenegro is very valuable, and allocating the funds until we would be able to say how important is this support of the EU in terms of strengthening and making better the whole of the health system in Montenegro. We were caught by surprise with this pandemic, which is a warning sign to humanity that nobody is safe unless we are all safe. And in this respect, the hand of support given by the EU is just demonstrating how much the unity of the whole humanity is very important in order to tackle this global issue. And therefore, I would like to underline the importance of this kind of support In terms of future work and developing the health system in Montenegro, as Her Excellency Ms. Popa said, pandemic is here. Of course, it will go away one day, but all what is given to us will remain with us. So this is a huge solidarity on behalf of the EU. Montenegro will try definitely to continue on its path to the EU, and we will try to accelerate the pace of our integration, because we think this is the right way for Montenegro and we should be persistent in that. Thank you.
Hvala puno ministarki.
Thank you.
Gospođi Kordić, imate.
Dobar dan svima. Na
Everybody.
linijama ovih sjajnih poruka.
Complementing this very nice messages, first I want to greet Ambassador Popa and Minister of Health. So these messages are really excellent, and it is just underlying how much the EU is our strategic partner, and our vision of accession is the right path for Montenegro. I'm very pleased that today with Mrs. Popa, we are assigning this addendum to the financing agreement. As you know, this support was given within the pandemic context. So we're talking about 9.5 million euros in terms of additional funds. In the times we live in, when the health of our those who are close to us are very worrisome for us, it's encouraging the fact that in the EU we have a strategic partner and a friend. Here, which is behind us, is demonstrating the basic fundamental principle of solidarity of the EU. Because last year 35 million euros were given to the EU and of course to the other countries in the Western Balkans in order to mitigate the financial and health impacts of the COVID crisis. The EU perspective of Montenegro has been strengthened by this very clear and very rapid response of the EU, and this is structured, targeted, and very valuable support to the health system of Montenegro. The EU has recognized among the first to help us in this respect, but also in long-term dealing with the impacts of the pandemic. Our citizens have recognized this as a sign that they are part of the European family, and they demonstrated that through the enlarged support for the EU accession. 75% of Montenegrin citizens, according to the latest surveys from January of this year, are in favor of the EU accession. Together with the EU, we are building a sustainable health system. From the total amount of 15.5 million euros, which are covered with this financial assistance within the IPA, we will fund 7 activities. These are actually huge projects, and their implementation will improve the service delivery and quality of services to the satisfaction of our citizens. The details of these financial agreements were mentioned by Ambassador. I would like to underline them once again. So we have construction of a building for 2 clinics for infectious diseases and for venerologies. Then developing micro labs and procuring equipment for them. Then equipping the Center for Prevention of Non-Communicable Diseases, and also financing the second stage of response to the COVID-19, and also strengthening the resilience of the whole health system. So these are very relevant elements for improving the health system of Montenegro in the long run. I would like to convince you that these, but also many other projects which are funded by the EU, will be implemented in a responsible way, in a quality way, and we will justify the confidence the EU has put in us. The process of Montenegrin accession, we always underline this, it has a transformative character. It's reforming the society, institutions, improving skills and knowledges. In parallel to that, the implementation of these kind of projects, we are making the whole process palpable and on the long run very beneficial for the citizens, especially this human dimension of supporting health and health infrastructure is strengthening the feeling of belonging of Montenegro to the European family, and it's making us believe that together with the EU citizens we are sharing the joint European future. Thank you.
Sad bih zamolio
Mrs. Kodic, and I would kindly ask Ambassador Popa and Minister Bojovic to sign the financial agreement.
Poštovani mediji, kao što smo se dogovorili.
Representatives of the media, we have the opportunity for a couple of questions, please. I'm sorry, I can't hear the question. Therefore, there is no interpretation. I'm sorry. I still don't have the sound, sorry.
Danas je 26. januar, interesuje nas da li je potpisan ugovor sa nekim od proizvođačima vakcina, u prvom redu sa Pfizerom, s obzirom na to da je najavljeno da se
I'm just interpreting from what I can hear. The question is about the date of vaccines, because it was previously announced by the minister that vaccines would be available already by now. So how long it will take before the approval of the vaccines to the vaccination itself, and how long do we have to wait? Thank you for this question. As you already heard from Ambassador Popa, it is a well-known fact within the COVAX initiative that we have provided a certain number of vaccines, and it is clear that COVAX initiative is ongoing, of course, a bit slower than we would like it to be, which causes problems for all of us, but it is for sure that it will be implemented soon and that we will certainly get the vaccines agreed upon through the COVAX initiative or mechanism. This specifically is the reason, and in order for us to speed up the vaccination process, we have, as I already said on a number of occasions, started working on the bilateral agreements with the producer countries and producers in general, and in this context, this is my answer to your question. I did say in December last year that we would do our best to start vaccination in Montenegro in late January or early February. We are still within that time framework. I cannot tell you the exact date. What I can say is that the action plan was prepared and that everything is ready for start of the vaccination, and that the bilateral agreement was signed with Russia. We expect these vaccines to arrive very soon, and as for the Pfizer vaccine, it was our desire to start with Pfizer. The agreement with Pfizer is in the final stages because the agreement has several stages and each of them is equally important. In the second phase of our bilateral discussions, we even agreed upon the number of the vaccines to arrive. We are just waiting for the agreement to be signed. It would already have happened if it wasn't for the delay about which you have been informed, and this is a global delay because in the past 3 weeks Pfizer has slowed down its work. which is related to production and distribution of vaccines, and this is the reason why this final agreement was still not signed. We do believe that it would be done as it was announced, and we are still holding the view that it is our desire to start vaccination in Montenegro with Pfizer vaccine, which again and again we expect it very soon in our country. I honestly hope that we would not lag behind the deadlines I mentioned in December, and on the other hand, I do have to ask the citizens for some patience, because you all understand that currently with Pfizer we have a situation which is not related to Montenegro specifically, it is related to the entire world. So in this context, you cannot view Montenegro separately from the system. It's, I guess, clear. Hello, journalist of Pobjeda. You just mentioned some contracts or agreements signed. Did you sign a pre-agreement with the Chinese producer? When it was signed, if you could tell us, and what exactly is written in that agreement? So, was it signed with the office that represents the vaccine producer from Bosnia, or directly with the producer? And which diplomatic channels have you utilized for that agreement? Because it's important to have this diplomatic consent. Do you have the diplomatic consent? We do, the minister says. And another question. Let me answer this one first, and then you will ask me. Thank you, Katerina, for this question. Yes, I did say to the public that we have signed a pre-agreement directly with Sinopharm or its central office in Beijing, and through the diplomatic relations between Montenegro and the Embassy of the Republic of China. So this is exclusively the path through which we have worked on the agreement, and pre-agreement was signed, and also we have agreed on the number of vaccines to arrive to Montenegro. And actually, this morning, before I came here, we had another contact and communication with the Embassy of China, and everything is going well and in line with the plan. The pre-agreement was signed on that day when I first said to the public that we were working on the final agreement and that the pre-agreement was signed with China. And this is also when we agreed upon the number of vaccines to arrive to Montenegro. 150,000 vaccines made by Sinopharm will arrive to Montenegro. And this diplomatic consent is provided? Yes, this diplomatic consent exists, and we have the answer from the Embassy of China. And today, just before I came here, again this morning, we had another communication with the ambassador. And can you tell us why donation offered by Petrostatis with 10,000 vaccines that was offered was turned down? Because these vaccines would anyway be verified and checked as all the others are. So did you ask Mr. Statis in which way he would provide the guarantees for the vaccines, and did you have any communication with him? Did you answer his offer to make a donation? As for this agreement, it was made through the Prime Minister, and I already told you, as the government, of course, led by our Prime Minister, we are grateful for any donation offered by any individual or organization. And of course, any donation is welcome. But I have to say what I already said to the media. We, as the government, have decided, because the health of the citizens is a priority for us. So this is the reason why we decided, as the government, that each and every procurement of vaccines is made through direct agreements, apart of course from the COVAX initiative as the most important one, and the European Commission for the Western Balkans, so that it is done directly through diplomatic relations with the producers or the producer countries. This is the reason, as I said, why any other form of procurement would require further caution, because we are currently in a very difficult time generally when it comes to vaccines, not only vaccines in Montenegro but also worldwide. And Interpol and WHO has warned that each country should be very careful when it comes to donations of vaccines through alternative channels. And this specifically is the reason why, and I can say freely to the public that we had other similar offers also to procure vaccines, but for the reason, again, that we want the vaccine to be 100% checked and safe for our citizens, we decided to have only those vaccines that come through direct connections and international bilateral agreements.
They can be checked. We don't have anything against for procurement and checking of those vaccines. I'm just saying that in this particular case, we are talking about the procurement, donation actually, through certain channel, which concretely is not dealing specifically with the import of medical devices and medicines. This is known to Montenegrin public, and that is why I'm saying, first, vaccines have to be checked from the aspect of quality, and we have to check the transport method, so we will have to check twice. But this is, of course, not disputable. We can check all this. I'm just pointing this possibility. First, we have to check the quality of the vaccine, which is donating, which is mandatory procedure, but also the way in which it's possible that a certain company, for example, which is not officially dealing with medicines or medical devices, and distribution of these medicines is a company that will procure these vaccines, because we will have to check that as well, how it comes to that. If they are donated, we will check them. Of course. Thank you. Both the vaccines and the channel of procurement. I can tell you immediately, the journalists can make any questions, because we are here because of the citizens. The citizens are the most important for us, and that is why there is another problem. You can, I won't avoid the journalists' questions. I'm confident that these are the questions made in a very benevolent manner. So the priority for us is the health of our citizens, and everything we're doing exclusively for the benefit of Montenegrin citizens. Milica Marinovic, Al Jazeera Balkans. I wanted to ask you, said that you order 150,000 vaccines from Sinopharm, and with Russians, and COVAX is 20%. COVAX is 20% of population. We're going to calculate that exactly. We have that signed in the COVAX initiative, and this is covering 20% of the population. Chinese vaccine, 150,000 in the first quarter, maybe even more later on if we need to procure more. That is, when it comes to the Russian vaccine, we are expecting in the first quarter 50,000 vaccines, and when it comes Pfizer, 50,000 in the first quarter. But these are the numbers which, with respect to the situation, will be changed, of course, can be increased, of course, with respect to the needs. Just another question regarding the new strain of virus. You have closed the border with the UK. At the same time, the strain is present in the neighboring countries, almost in all the neighboring countries. Do you think that the current measures where the borders are open without the testing is good? Because we have this new strain of virus which is more deadly and spreading faster. Well, when it comes to this question, a very, very good question, because I want to clarify. When it comes to this new strain of virus, it occurred, as you said, and majority of the transmission cases are in the UK. And that is why we requested that the foreigners coming from the UK must have PCR tests, which by itself does not mean that the PCR test will be absolute security for us. It can happen that even PCR test when entering to our country can be negative, but then in the following days might become positive. What is a general problem of corona, like other viruses, are forms which are very easy. They're easily mutating. They're changing the form, and in order to survive and adapt and protect themselves. that is why it's quite expectable that these kind of mutations are happening. This is not the only strain we are going to encounter, definitely. What is also evident is that we cannot isolate ourselves from the world. As you know, we cannot expect that we will be the only country in which this new strain of virus will not come. Whatever we do with the borders, however strict measures we impose, we won't be able to do it. So we are coming back to our position, complying with the measures. Complying with the measures is the essence of protecting ourselves from the virus. If we comply with the protective measures, elementary measures, which are everywhere globally present, the transmission of the virus will be smaller or even disabled. And that is why when it comes to these mutation forms of the virus, we are expecting to maybe identify them at a certain point in time. You know, the viruses are changing their forms very easily. It's quite possible that we're going to have another mutation of this virus. And even certain strains have been present since the January of the last year when everything started. That is why I'm asking the citizens to comply with the measures and to be patient until the vaccines come. And the vaccination is an important protection method. This is a crucial way how to protect the citizens through vaccination. In this respect, vaccination should be taken very seriously, and that is why we are investing great efforts in order to start with the vaccination in Montenegro as soon as possible. I mentioned on several occasions that we had a problem with the start of vaccination, not because we were, being late with the new administration. There are several reasons. First, as you see, the COVAX initiative is, slowed down. This is very clear. Secondly, European Commission and the Western Balkan are, slowing down. Pfizer, as the first registered vaccine, is also slowing down the production and distribution. Fourth reason, the previous administration, Montenegro, signing the COVAX initiative, didn't do anything with respect to vaccination. I mentioned that on several occasions. In June and July, countries in the region were starting bilateral negotiations with the producing countries and manufacturers. In Montenegro, these kind of agreements were not signed. There were not such initiatives. And all this together is creating a lot of problems for us, and now we are investing huge efforts in order to solve this issue and to start with vaccination as soon as possible. Thank you. Thank you.